Welcome to the JOMA podcast, presented by the Jewish Orthodox Women's Medical Association. Every week, hear from expert medical professionals as they share up-to-date insights on health topics to help you live your best life physically, mentally, and emotionally. Join us as we navigate the ever-changing landscape of healthcare and strive to improve the health of the Orthodox Jewish community.
Welcome to the JOMA podcast. I'm your host, Jenny Berkovich, pediatrician and director of education for JOMA. We haven't talked about COVID in a long time, so I thought it might be a good time to bring it back up for discussion. My guest today is Dr. Felice Stockwell, and we talked all about long COVID, especially in kids. Dr. Stockwell is the chief of the Division of Child and Adolescent Health and the Felice K. Shea Professor of Pediatrics in the Department of Pediatrics at Columbia University College of Physicians and Surgeons, and a professor of Population and Family Health at the Mailman School of Public Health. Additionally, she is a practicing pediatrician. Dr. Stockwell's research program, which concentrates on underserved children and adolescents, focuses on interventions to improve vaccinations with an emphasis on health technology and health literacy, as well as on respiratory infections and long COVID. Dr. Stockwell is the chair of the Pediatric Coordinating Committee for the NIH's Recover Long COVID initiative. Welcome, Dr. Stockwell.
Hi, welcome to the podcast.
Hey, thank you so much for having me.
Yeah, so I always joke that I try not to have like so many pediatricians on the podcast because it's the easiest thing for me and the thing that's the most interesting to me. But I really try to have guests that I think other people will also find interesting. But here we are, and I'm interviewing yet another pediatrician. But the focus of your work is saying something very unique and interesting. So would love to hear a little bit about how you got involved in the type of taking care of that types of patients that you see.
Yeah. So I actually got involved with long COVID because there's a initiative through NIH called Recover, which basically is this very, very large initiative to try and understand long COVID. And there's an adult cohort and a pediatric cohort, and then some other groups as well. And I help lead the pediatric cohort. And so originally, they kind of were asking people who wanted to be involved. And when we at Columbia decided to put a team together because we really wanted to make sure that the children, and particularly in the Washington Heights and inward neighborhood that we take care of in the South Bronx, will be represented in this national study. And so that's how I began to be involved in long COVID.
I think when people hear long COVID and kids, the initial reaction is, huh? Kids get that? So would be so curious for you to speak a little bit about like how prevalent it is and if there's anything unique when we talk about long COVID as it relates to kids versus maybe the adult counterparts.
Yeah, no, it's a very great question. So I think, if we think a little bit back to that kind of early 2020, and you remember this well because you're also a pediatrician, and everybody was saying, oh, children don't get infected, with SARS-CoV-2, and all of us were saying, no, that's crazy. Of course they do. At the moment they were sheltering in place and they weren't getting out in the world, and so there was this huge misperception that kids, didn't get COVID infections, and then there's a misperception that they got COVID infections. It would always be mild, and we knew that also wasn't true. And we think we've finally, gotten people to sort of understand that. But now there's really this current misconception that kids don't get long COVID. And if they do, that looks exactly the same as an adult. And we now know that that isn't true. I think it would be helpful first if I sort of define long COVID, because I think a lot of people, if that's okay with you, a lot of people don't really know what long COVID is. So first of all, it's really important to think about it as a chronic condition. So we think of, COVID infection as, temporarily kind of acute, and then long COVID, by the name, is a chronic condition. And it occurs after our SARS-CoV-2 infection, but it may not be immediately after. And that's what I think can make it kind of complicated for families and also for doctors to diagnose. So it could be a persistence of symptoms that, someone who has a lot of, say, fatigue during COVID infection then continues, or it could be new symptoms that evolve, and they could evolve even weeks to months after the infection. But the definition right now, there was actually a working group from the National Academy of Science, Engineering, and Medicine that kind of came together to try and define long COVID. And for them, it's if you have these sort of prolonged symptoms that are there for at least 3 months, they actually can affect any body systems. And for some people, it's just one organ, and some people it's many. And the symptoms can be continuous, they can be progressive, or they can come and go. So think of it as relapsing and remitting. And all of those things together are how long COVID can present. It also can present after a mild or asymptomatic infection as well as severe infection. So it's not only the people who say were hospitalized with COVID. And it's also kind of a huge impact, obviously, on the child and adolescent and the patient, but also on their families. And so families who have a child with long COVID really have an impact, on the entire family. You had asked just in terms of how prevalent it is, and we actually don't really know because there's a lot, or we have sort of an estimate, in part because a lot of the studies initially would look at any kind of prolonged symptoms and not necessarily comparing people who were infected and not infected. There was so much going on at the time, also just in general for children and adolescents. And so there's, as well as all the time, kids may have symptoms. So we think it's about 2 to 10% of kids who have an infection will go on to develop long COVID.
I think at this point, right, COVID's been around long enough where we know that we've sort of like achieved relative herd immunity, right? Either through immunization or natural infection. In other words, like very common for someone to have had COVID. And thus probably very common for somebody when tested to show evidence of a past infection, right? Or antibodies. When someone comes with sort of these vague constellation of symptoms, and then you go on to do your investigation and it turns out that they have evidence of a past infection or antibodies. How do you make the determination that it is long COVID versus maybe something else that is now, right, contributing to their symptoms, right? I don't know, autoimmune things, organic, non-organic, right? There's a whole bunch of things that
Yeah.
probably cause these very same symptoms. How do you know that it's long COVID and not something
Yeah.
else?
Yeah, so one of the things is we don't yet, and hopefully at some point we will have a biomarker, right? So when we think about a biomarker, that would be a blood test, right? Wouldn't that be amazing? We could say, we do this test and we can say that you have long COVID. And unfortunately, we don't have that yet, but a lot of people are looking and trying. You're right. Many people have had an infection, at least one. A lot of times you talk to families, though, they can say, like, I know when my child was different, right? Like something changed in them, particularly the kids who, are severely affected. And oftentimes they can think back and be like, yeah, it was maybe a couple of a months earlier. So there usually is something to that can tie it together. If you kind
It's
of
an
if you're
acute
looking
shift.
for it, yeah.
It's not something that kind of like, oh, now that I think about it, I've always had fatigue. Like there's a clear
Something new,
distinction.
right? So these kids, like
Yeah.
families will say, like, I don't understand, here's what we may commonly hear, like they were an athlete and they, would get up and they would be in football practice or they would be doing this or doing that. And then suddenly they can't do even the regular things,
Oh.
much less the sort of super athlete things. So they really see a big change. And you're right that there are other conditions that can mimic some of the symptoms of long COVID. And so, as a pediatrician, we're used to this, right? We're sort of saying, okay, this is my differential, which means all the different things we're thinking this could be. And I'm going to do this test, look for this, looks for that. But, but we're also thinking about long COVID. And I don't want to sort of give the impression that long COVID should be a diagnosis of exclusion because I want people to be thinking about it. But obviously you want to make sure, that you've maybe ruled out some of the other things that could cause those symptoms. But meanwhile, if the child's really suffering, that we're trying to, to help them in all the ways that we can.
So we've talked about fatigue a lot, or like an acute
Mhm.
change, right, in their energy level. Maybe an athlete who can't function at that same level anymore. I've
Mhm.
also heard the term brain fog, which to me sounds just
Yeah,
absolutely terrifying. Curious, I know it's still sort of a little bit nebulous, but what are maybe like some more concrete, like, or buzzwords or things that should
yeah.
clue us in, like, long COVID. Fatigue is certainly one that I hear a lot, but to be fair, right, we see patients with fatigue for all sorts of reasons.
Yeah, that's a good question. So one study that we did as part of Recover was to try and look particularly at school-age children and adolescents. And we basically compared kids who had been infected against kids who had never been infected. And so there are still a few kids, some kids who've never been infected. And that's a really important um, a comparison to do. And that's what I had mentioned, because we want to make sure that we're looking for those kind of symptoms that are really more common in those kids who have been infected. So we found some symptoms that actually overlap between school age and adolescence. So some of them are general symptoms. So, trouble sleeping, the tired after walking, daytime tiredness, sleepiness, poor appetite. We also see increased risk of behavioral or mental health issues. So feeling depressed or anxious, sometimes specific fears, like we had found fears of enclosed spaces. Then we think with the nervous system. So the trouble with memory or focusing, that's for the brain fog that you mentioned, but also headaches. Actually, headaches can be actually a very common symptom in long COVID. There can be others. So if we kind of think about the heart and lungs, sometimes kids can feel very lightheaded or dizzy. We also have kids where their symptoms are predominantly gastrointestinal. So kids who suddenly are really having a lot of trouble with stomach pain or nausea and vomiting, and that wasn't something that they had before. And another kind of hallmark is pain. So not only headache, but body pain, muscle pain, joint pain, back pain, neck pain. And so, maybe you're looking as a pediatrician, you're thinking, okay, they have body pain. I'm checking all those things, and they don't have any kind of rheumatologic disease, but they really have this intense pain. That can be one of the hallmarks of long COVID. We also found some things that were specific for school-age children. So in some of those kids, they had like itchy skin or skin rash, and that's something that if you remember kind of early on, families would talk about these sort of strange rashes. Some of them can get palpitations, so kind of heart, sometimes feeling like your heart is really beating very quickly, as well as some more specific fears for things, and also school refusal. So if you have a child who sort of is suddenly refusing to go to school, obviously think about all the other reasons they might be refusing to go to school, but also think a little bit about there is, potential risk. And then for adolescents, but not school-age kids, the kind of correlates that was panic attacks. So adolescents were having more panic attacks than adolescents who have been infected versus those who were not infected. And then the kind of hallmark of COVID infection, that loss of change or loss of smell or taste, which I think we all think of now as part of COVID. We see in adolescents, but we actually don't really see in school-age kids. And obviously, if you have someone with sort of prolonged loss of taste and smell, you're already kind of thinking about long COVID, particularly if it's now been 3 months, right? So we're used to seeing it part of the acute infection, then it kind of you starts to come back. But if it's prolonged, that's obviously you'd be thinking about long COVID. So you can see there's sort of a huge constellation of symptoms. There have been over 200 symptoms that people have reported as a long COVID, but those are some that might be a little more common for school-age children and adolescents.
The scary thing for me is as you were going through those, I was like, gosh, I don't think there's like a system that exists that you didn't mention as being affected. So it's one of those
Yeah.
things that it sounds like really doesn't discriminate and can affect just about anything.
Yeah. And actually, to that point, we're actually starting to see potential like clusters, like way that symptoms might cluster together in kids. And so for children, adolescents, there's some kids where it really is their entire body that's affected. So they really have many, many symptoms across multiple parts of their body, and they really are the most severely affected. And so there's sort of something that just kind of went haywire in their body. Then there are also some school-age kids and adolescents where it's really, the syndrome really is more about kind of pain and fatigue and low energy. And that can actually look a lot like some other post-viral chronic conditions that you may be familiar with, like, for example, chronic fatigue syndrome, for example. Then for school-age kids, there's a cluster around the kind of trouble sleeping, the brain fog, and a different one that's really just about GI symptoms. And then for adolescents, again, this ENT, this ear, nose, and throat, loss of taste and smell. So sometimes they're clustered together in different groupings that might make you be thinking about long COVID, and sometimes it's really just sort of the entire body. And so you do want to be thinking, I think, of both levels if you're a pediatrician, but also as a parent, if you're seeing something that doesn't seem right in your kid and it's just really persisting.
So let's talk a little bit about what works, because I imagine there's probably a whole bunch of things that you and your group have studied or have looked into. So we probably more discreetly know what doesn't work, but maybe let's start with at least like standard of care of what's offered as like first line therapy once you feel relatively confident you're dealing with long COVID.
Yeah. I think that's actually what's really hard, is that we don't have a really good treatment for long COVID. And I wish that we didn't, and it's something that really is absolutely necessary. We really need to have clinical trials specifically for children and adolescents for long COVID. So a lot of it is unfortunately symptom management, kind of depending on what symptom someone may have. So example, for someone who's feeling lightheaded or dizzy, and they might end up having something called dysautonomia or have something called POTS, which is this, basically when kids stand for too long, their heart rate goes up very high and they feel very dizzy. Then you are treating that symptom. So you might be using compression socks or salt tabs or making sure someone is hydrated. If a child has headaches, we'll be focusing on the headaches. There are other medications that some people use that to try and affect long COVID more globally. We really don't have that sort of like, this is how you should treat it, unfortunately. The other thing is, I think just rest is really important. And particularly for the kids where fatigue is a real big part of their long COVID, we may kind of think a priori that like, oh, we just need to rehabilitate them, right? We just need to like get their deconditioning to get their strength back up. And actually what's really interesting is that's the exact opposite of what you want to do. Yeah. So if you take a child with very severe fatigue from long COVID, and you put them into, say, like physical therapy rehab, and they kind of exceed what their energy expenditure, you actually will set them back and actually make it much longer for them to get better from their long COVID.
Sorry to interrupt. I just think that's
Yeah.
such a critical point because that
Yeah.
is so counterintuitive
I know.
to, right, any other approach that we have for things like dysautonomia, like POTS, right, even chronic fatigue syndrome, right? The whole like approach to caring for those patients, and I've learned this also from like prior guests on the podcast, is exactly that, right? You increase our conditioning, it's physical therapy, maybe physical therapy specifically aimed, right, at a patient population with these limitations. So that's why I think it's really, really critical for this work to continue, because making an accurate diagnosis is going to basically determine if you have treatment A or treatment B, which is completely different and the opposite.
And it's actually very similar, I think, to the people with chronic fatigue, for example. So there's an entity called post-exertional malaise, which can be seen with long COVID and can be seen with ME/CFS. And what happens is basically even sort of basic physical or mental exertion that you may think a child goes to school all day, or we're on a sports team. It's not necessarily that they get very tired that day. It's the next day or the day after that they just are completely worn out. So, for example, a child may have gone trick-or-treating with their friends and like been super excited, and the next day is just like on their couch and can't get up. And so there's something basically called this push crash cycle, where the kids or adult who has post-exertional malaise will really push themselves because they're feeling good, and then they crash, and then that can set them back. And so a lot of the time, families are kind of taught to think about, or kids, about this something called an energy envelope. And the idea is that you sort of have this level of energy, and you sort of need to learn like where you need to stay, because if you go over that, that's going to set you back. But you also don't want to go under that, right? Like you want to make sure that you are doing the things that you want to do, and when kids need to be kids, but really understanding how to do that. And so there are existing protocols, say for POTS or for ME/CFS, for rehabilitation. So I'm not saying these kids shouldn't or can't, right? They should, but it has to be done by someone who knows what they're doing, because the sort of push you a little bit further is actually not what you want to do. So it is very similar, probably, to what your other guests have talked about POTS or talked about ME/CFS. That's the same thing that we're talking about when we talk about kids with long COVID who have that component. Not everyone has that post-exertional malaise component, but it is, one of the hallmarks of long COVID in adults, and also we do see it, particularly a little bit more in adolescents, but also you can see it in younger kids as well.
I'm really curious about specifically some of the mental and behavioral health,
Mhm.
right, consequences of long COVID. Do you treat those as you would if it was just isolated anxiety, depression, I don't know, right, fears around school, or is there a more unique approach tailored to these patients?
Yeah, so currently it's treatment sort of just as one would for anxiety or depression. So it's the same treatments. There is a question about whether actually serotonin has an impact on long COVID. So actually there's a potential plus benefit of like SSRIs, for example, like we're treating depression, for example, but there's a lot we really, again, don't know really what's causing long COVID. There's sort of a lot of different potential biological or different mechanisms that could be, and in different people, like it probably is kind of different pathways to kind of get to similar symptoms. But again, the treatment is the same. So either medication or, for children and adolescents, some is cognitive behavioral therapy, depending around the anxiety, for example, is helpful. I think
other
for
thing,
school refusal is sort of think about, is a reason behind it, right? Is they don't go to school because they're so exhausted, right? That it's just too much for them. And figuring out sometimes a lot of these kids might need an individual's education plan, IEP, or need 504D, so that they can actually get help and be able to be in school and kind of do all the things that they need to do in school, but in a more supportive environment, because, for example, of their fatigue or say their brain fog or whatever their symptoms might be.
what's the prognosis?
Yeah. I think, a lot of these, some of the kids do get better, right? So there is sort of this, like, there's a 0 to 3 month part window where a number of kids can get better. And that's sort of why there's this 3 month kind of cutoff. And then there have been some more adult papers and a little bit, one pediatric paper out of Italy, which actually was a really nicely done paper that kind of talked about the trajectory where the sort of 3 to 6 months and another group. But when you're getting past 6 months, 6, 9, 12, 18 months, it's really becoming this chronic condition, then, it is, sort of smaller and smaller numbers. We usually really don't know a huge amount of the trajectory, and that's part of also what we're doing for Recover, is really to kind of understand. We bring kids in first, for 6 months, then yearly. So we really can try to understand kind of what are some of these patterns, so we can understand the trajectory, and then ultimately try to identify risk factors as well as resilience factors, both for getting long COVID, but also if you have long COVID for, for not progressing or for kind of going into remission.
Let's dig into that a little bit. You said something kind of interesting in the beginning, is that there's no real like prediction of developing long COVID that's associated to the severity of the initial illness. I think a common, what sounds like a misconception people have, is like if you had mild disease or maybe asymptomatic, you're not necessarily at risk for long COVID. And if you were super, super sick, maybe even, needed emergency room treatment or needed to get admitted to the hospital, you're at risk. Doesn't sound like that's the case. I'm curious if there's any risk factors that you've been able to flag.
Yeah. So that's some ongoing work for Recover. And so I think when, I'm happy to come back when those papers come out, so we can talk about those. I think it's, again, important to understand some of the possible mechanism long COVID. So there's a mechanism which is sort of from medical intervention, right? So obviously, like if someone was in the hospital and, mostly adults who are, say, on ventilators, right? There's like direct damage from being that sick. And so that's like kind of one part of long COVID. The loss of smell and taste, right, seems to be kind of more of like a direct effect, sort of on the olfactory neurons, for example. But there's also sort of this kind of question whether if there's like a big inflammatory response, right? That's going to be for the kids who really are having it kind of everywhere. There's a question about viral persistence. So maybe there's kind of pieces of virus that's really still in the body, and that's kind of causing your body to kind of always be activated, right? And causing symptoms. There's also a question about reactivation of viruses that we might have already. So for example, the Epstein-Barr virus, that causes mono, or some of the herpes viruses. There's a question of whether those might get reactivated from an infection. And then it's really sort of those viruses kind of being reactivated and kind of smoldering that's causing these, basically causing these symptoms. So you can imagine, right, that's why maybe an asymptomatic infection or a mild infection could have long COVID the same as severe infection, because it's not only sort of the direct damage of the virus, it's sort of this ongoing, almost cascade, right, that's in your body, and that could be kicked off by, any number of kind of levels of infection.
We talked about this a little bit when we we're discussing like diagnosis and really making the distinction of like symptoms being a result of long COVID or not. But I just realized we never really talked about like what a typical workup is. I think the general like thinking in the community, right? Like people thinking is like, I have these vague symptoms. They check if I have antibodies to COVID, right? Whatever that means. And that means I have long COVID. One, is that actually the workup? And two, or is there any like additional testing that can be helpful? I know you mentioned we're researching biomarkers. Obviously, that's not a tool that's available just yet, but like what other things
Yeah.
exist as part of that workup?
Yeah. So I think, particularly say for pediatrics or for children, and to the American Academy of Pediatrics has these sort of guidelines on their website. So, there are some lab tests people do, and it's really not because you're going to see anything wrong with long COVID, but you're sort of doing other things. So, for example, you might be checking a complete blood count because you want to look for anemia. People are kind of doing like a comprehensive metabolic panel, sort of looking at, the electrolytes look okay, looking for general inflammation. So, for example, an ESR or CRP, which would be familiar to you, checking thyroid levels, because again, if someone's very fatigued, you want to make sure their thyroid's not involved, vitamin D levels, and then sometimes people will do a packet EBV panel, so Epstein-Barr virus panel. Most times it shows absolutely nothing, except a lot of kids have low vitamin D, and not because they have long COVID, but because, as you know, also like particularly in places like New York City where I am, every child unfortunately has low vitamin D levels. So sometimes you'll find things that are unrelated to long COVID, but you'll see. But again, if the symptoms persist, then you might be starting to do a workup that's sort of related to symptoms. So if a child is having respiratory issues, right, then they may be sent to a pulmonologist who is going to do pulmonary function tests, make sure everything looks okay there. Usually it is. If they're having fatigue, they might go have a special test called a CPAT, which is a cardiopulmonary exercise test. And that's basically they're usually on a bike, or they could be on a treadmill, and they're kind of looking at how they're doing as they're exercising, and that can be helpful. So sort of, again, if you having a headache, they might be trying to rule out other causes of headache. So a lot of it is sort of, again, symptom based in what it is. The other thing is always kind of trying to remember for anything for pediatrics is you first want to make sure that, are kids sleeping well, right? Like, are they going to bed at a regular time? Are they having good, normal kind of sleep wake cycle? How's their nutrition? How's their activity? How's their stress? Because in any condition for any child, all of those things can make it worse. So that's sort of the first kind of the first level is sort of how to kind of support the child, and then kind of looking into these various things. And the problem is, I think that pediatricians are afraid to sort of make the diagnosis of long COVID because they're like, I don't know, how do I know it's long COVID or not? But in reality, then the kids aren't getting the care that they need and aren't getting the supports in school. So if you're seeing a child, or you think your child might have long COVID, bring them to your pediatrician, if it has a constellation of symptoms, right, and it's persisting, it's okay to say, I think that this child has long COVID, right? That's only gonna help them, and help them kind of get the care that they need. And then again, look on a specific symptom, making sure that we're doing whatever we can to help support, basically the symptoms related to that. There are also some long COVID clinics, unfortunately not enough. And so if you live near one, getting your care there, or sometimes there are ones where you can travel to as well, particularly for the kids who are really kind of very severe symptoms where it's really affecting their whole body.
Let's talk a little bit about prevention. Is there anything that families can do either to lower their risk or prevent the potential development of long COVID?
Yeah. I mean, the best prevention of long COVID is not to get not to get a COVID infection, unfortunately. So, I still, obviously, I think that, in this world, a lot of people are saying, oh, COVID, it's fine. And I think we have to say, like, look, if you have a COVID infection, like there is a risk of, potential risk of long COVID. There are some nice papers that have come out that show vaccination has a, preventive effect against long COVID in adults as well as in kids. So I think, being up to date on your vaccines, I think actually is helpful, potentially for preventing long COVID. And then I think we'll hopefully begin to know a little bit more about the risk factors and be able to kind of tell people kind of more what else they can do. But, I still in New York City when I'm traveling and I know, like, I know what the COVID rates are. Like if I'm on the subway and the COVID rates are high, like I just wear a mask. Same as like, when flu rates are high, wear a mask. But I try and not put myself in situations where I could get a COVID infection, as well as other respiratory infections. I also don't want those either. For example, there's a lot of high flu rates right now. So I think using common sense about trying to avoid getting infected. And then I think, actually, I do think vaccination is important.
I'm curious if you see vaccination as protective as like a one-time intervention, or it's something that really needs to be ongoing. And I know that's like a whole separate topic, right? What's the value of like annual
Yeah.
vaccination? Do we treat it like a flu shot? But at least based on the research that you and your group is doing, is there any like, are you leaning one way or the other?
Unfortunately, we don't really have the answer to that yet. So I can't. I wish I could give you that answer. And maybe again, if I in the future, it's something that we are actively looking at. But yeah.
Okay. I want to wrap up by asking a question that I like to pose at the end of every episode, which is from a preventative health lens. Is there any one thing that like you really wish people knew, or like one thing that you find yourself maybe like repeating over and over every day to patients that you wish you could kind of like shout and publicize?
Oh, it's in prevention. I think obviously I'm also a vaccine person, so I think vaccination is really important. I think for long COVID in particular, I think I would say, and again, this isn't so much prevention of long COVID, but prevention of the harms of long COVID, which is, believe your child and believe yourself. So, I think that a lot of families of kids with long COVID, they really suffer because the, the pediatricians aren't, not believing them, but they're discounting their
Yeah.
symptoms and they're not like naming what it is. But there is also a lot of family people who will say, oh, you can't get long COVID in kids, or schools that aren't giving them the support that they need. And the families are really, really suffering and the kids are really suffering. So I would say, you know, um, if your child has these prolonged symptoms, go to your pediatrician. There's actually a really nice tip sheet that Recover made. So if you kind of look up Recover long COVID tip sheet, it's a nice sheet to kind of go through maybe things to prepare for your doctor's visit. Just to kind of help have that conversation, because a lot of pediatricians actually don't know a lot about long COVID, but pediatricians always want to, are there because they want to take care of kids. And so I think talking to them about it, having them read about it and look it up, I would say, it's okay to advocate for your child. It's okay, if you have a child who has symptoms for them to advocate for themselves, both in healthcare, but also in schools as well. It makes a big difference.
I love that. I think that's actually really, really impactful and important takeaway. Dr. Stockwell, I want to thank you so much for your time today. This was super important, and I suspect that we're going to need to do a part two, hopefully in the not too distant future.
It would be great to come back, and I feel very fortunate. Again, Recover is this amazing collaboration of institutions across the United States and amazing number of investigators, and lots and lots of families who really have given our time, and also patient representatives. So I would be happy to come back and share what we found. I think it really is a very unique group of people who have come together to help study this problem.
Thank you for listening to the JOMA podcast. We welcome your feedback and ideas for future episodes. Send us an email at health@joma.org. Don't forget to subscribe, rate, and review us on your favorite podcast platform.